Hello, my name is Jeff Webb. I work at Boston Living Center, which is part of Victory Programs as a peer support services specialist. The word peer in my title connotes that I have lived the challenge of being diagnosed with HIV. That was in 1999. I was very much floored when I found out I was HIV positive. I chose denial initially, rather than dealing with the issue at hand. This was a death sentence. At least that was the word on the street. I was fortunate, though, to land at Mass General Hospital and secure a primary care physician who made it clear that this was just a disease. It was not a death sentence. But I still went through a lot of crying, a lot of soul searching, a lot of withdrawal. I withdrew from my family. I withdrew from my friends. I involved myself in drugs, all trying to escape this reality. It didn't take long, though, before I saw that continuing this lifestyle would not be to my betterment. So with some counseling, I began to turn my head around and look for what I could do to save my life. And that brought me to Boston Living Center as a member. At BLC, we don't have clients, we have members. I approached those doors in 2007 seeking support, camaraderie, and education. And that's what I found. One of the staff took me on as a mentee, which was a lifesaver. She was very patient, very kind, and very understanding. She was also the clinical supervisor for one of the educational programs here, which broke down the ABCs of living skillfully with HIV in accessible, useful, scientifically based detail. It was a great course, and I got a lot out of it, so much so that I began to aspire to learn more. So I did, and that was seen. And after a while, my mentor asked me if I would co-facilitate the group. Then in 2010, I was hired as peer support. And in 2012, I was promoted to peer specialist. A lot of people who come through here have nothing. They have no food stamps, no SSI. We help them access those benefits, and I actually love sitting down with the member and doing an online application. But in most cases, really in every case, our work also involves helping members manage the mental aspect of living with HIV. Maybe that's the most important part. Most of our members have experienced profound trauma. Many still do. At the very least, they're dealing with stress and other mental health issues. I've been through it myself, so I can speak to that experience. And that is where the person-to-person aspect comes into play. We embrace people, we engage them. Speaking as peers, we open ourselves up in order to help members share their own lives. The draw for many of our members is the meals program. The great majority tell us that BLC is their primary source of food. That's often what brings them here in the first place. And that's fine. We meet people where they are. Whatever they give me to work with, that's what I'll use. If someone says, I just want to eat something, great, let's go have lunch. We can finish the paperwork later. But what really keeps people coming is the incredible social impact. There's a real need for people who are HIV positive to have a place where they can feel comfortable. BLC is that place, and that's just as important as programming. What we want to do is bring you to the point where you can prepare yourself for what you desire. Go out into the world and ask for what you need. And you know that you have backup, a support system. And that takes talent. That takes commitment. COVID-19 has changed things some. We've had to adapt in a lot of ways. We've been providing meals to go and bags full of food to take home. And now we've reopened congregate meals again, physically distanced, of course. We've started running support groups as well. By the way, we talk about physical distancing at BLC, not social distancing. We've been fighting against another kind of social distancing, the stigma attached to HIV and AIDS since the BLC was founded. The most important thing we can demonstrate to each member is you matter. And it matters to us that you get your life back. That's always been our message. We are here for you. Over and over in this work, there's that critical moment when we first get to really engage with someone or re-engage after an absence. It could be that person that started coming through our door just for the meals. That might go on for weeks, but then there's that day when they turn to you and say, "Can you maybe help me with something?" Or it could be a member who we haven't seen lately because it's been difficult to come in with all the disruption that the pandemic has caused in their lives. And then there are people who have moved on, people we haven't seen for a year or 20 years. But something's happened, and they thought of us. Because a BLC, once a member, always a member. And there's simply no place like this. I say that from my personal perspective as a member and a staff person. And when that moment comes, I always say the same thing. It's good to see you again. Now, what can I do for you?